October, of course, is Breast Cancer Awareness Month, a time to spotlight the importance of early detection and, of course, the advancements that are making breast cancer treatment more precise and patient-friendly.
Yes, at UnityPoint Health Trinity, one of those advancements is the MOLLI surgical localization system. And joining us today is Dr. Melinda Haas, Medical Director of the UnityPoint Health Trinity Breast Center. Dr. Haas, thank you for joining us today.
Yes, absolutely.
Yes, a very exciting time for UnityPoint because this is really relatively new technology, and you've actually brought it with us or with you today. So give our viewers an idea of what this MOLLI system is and how it works.
Sure. So MOLLI is a system that's used in the operating room, so by surgeons. It's known as the MOLLI marker, and it's placed in radiology, and then the surgeons use it to identify something that you can't feel. So an occult lesion, something non-palpable.
Okay. So talk a little bit about how this is, improving the experience for patients. So somebody that is, going through a breast cancer diagnosis and then a surgery, what does this mean for them?
Sure. So what it really does is it makes it so that the surgeon can be more precise when they remove a lesion. So it's about precision, it's about minimally invasive new technology. So a smaller incision, a closer incision, a more desirable location, also removing less normal tissue and just going for what you need to remove for the abnormal tissue.
That is huge. I mean, I think everybody knows somebody that's been affected in some way by breast cancer. I mean, and so for my mother, for example, I mean, you take that type of thing for granted. You just want the cancer out. You think at the end of the day, that's all that matters. But it's not all that matters to a lot of these patients. So when you talk about reducing the amount of tissue and things like that, that maybe having to be removed, that is a very big deal.
Yeah.
Absolutely. It's all about oncoplastic surgery today. We want to be focusing on obviously good oncologic surgery, but also having a good cosmetic result and a good cosmetic result for the patient in the end.
Wow.
We were talking before the show that you actually learned about this technology earlier this year in the spring, and here we are in the fall, and you've got it at UnityPoint.
That's
so
right.
Why is it important for your patients to have access to this technology right here in the Quad Cities?
So yeah, you're right. It was just presented to me at the American Society of Breast Surgeons conference this past spring, and what it really demonstrates is how committed UnityPoint Health is to having the latest, best technology here in the Quad Cities.
Yeah, we have kind of a demonstration happening here on the screen that you all provided for us here today, so we can kind of see it in action. So from a surgeon's perspective, this is really, really helpful in the operating room.
Yeah, absolutely. So what you're seeing right there is actually the Onco pen, and it's localizing the lesion in the operating room. That needle was, before that, was the needle placing the MOLLI marker, and the marker is 3.2 millimeters. It's the smallest marker on the market today. It's non-radioactive, so a lot of advantages to it. On the other side of the screen, you see the bullseye, and that is the very small pen, and you can see the area. It's going to localize where the lesion is.
Okay, and you brought the system with you here today,
I did.
so thank you so much, and to your entire team for kind of loaning this out so that we could see it in person. So yeah, you're going to kind of give us a little bit of an example of how this all works.
So this is the tablet, and this is what's in the operating room. It can be put up on a pole so that it's easy for the surgeon to identify. Here's a breast model, and this is called the bullseye right there, and that's where we're going to be looking. So you place the pen, and I happen to know where this marker is, but you can see the marker is going to be right in the center, and the closer that you get to the marker, right there, it goes green. Not only does it go green, but you see exactly how many millimeters away. So the closer and the deeper that you get, the closer that you get to the marker. So there's an auditory, there's a visual, there's a depth perception, and it can help us make a very precise identification of where the abnormality is.
It's incredible.
Incredible. Yeah, it's amazing what technology can do these days, and it's coming at us really quickly. So how does having this technology really fit into the overall care you have at UnityPoint with the patients and the approach to breast cancer health?
Well, obviously, it fits into our whole multidisciplinary approach. It's not necessary for people that need or desire mastectomies, but in the breast conservation approach, where you're doing lumpectomies, it's going to be very essential to getting the best results.
Absolutely, and all of that too. I mean, we've been talking about the cancer center expansion, and of course, breast health is a major part of that, and breast cancer. Can you give us a little bit of an update on how that's been going, the expansion, and just how meaningful it is to patients and staff and surgeons to be able to be working on this and expanding it in this way?
Sure. So again, UnityPoint's very committed to all around technology and updating things.
Yeah.
Our breast center, we've got a lot of other exciting things that are on the horizon too, and I hope I can come back and talk about that in the future too. But overall, our whole cancer center is expanding, and I know you have an announcement about that too.
We do. It's very exciting.
Yes, very exciting announcement. So because of this year's UnityPoint Health Cup, so of course we featured the UnityPoint Health Cup on the show in the past. $130,000 was raised to support the Trinity Cancer Center expansion. So Kevin Phelps provided us with this photo. He's there in the photo with the check presentation. This is a really big deal. We've talked about it on the show in the past, the expansion here and all the state-of-the-art oncology care that's happening. And it truly, I think, allows your entire team to see a patient through from diagnosis and beyond that to survivorship.
Yes, absolutely. Our cancer program is just very center of excellence oriented and always improving.
Yeah, wonderful.
Yeah, that's excellent. Well, if you want to learn more about the Trinity Breast Center, you can learn more about both of their locations in Iowa and Illinois. Just head to unitypoint.org and you can choose which location. And Dr. Melinda Haas, we really want to thank you for being here today and giving us some insight on this new technology.
Yeah, thank you for
really
having
great.
me.
Yes,
Absolutely.
thank you so much.